Multiple research studies have shown excellent outcomes for patients using ForeseeHome monitoring, with unprecedented compliance. To understand more about the program, we turn to those who matter most, current and former ForeseeHome patients. Jane Esselman was diagnosed with intermediate age-related macular degeneration when she was 60 years old. She explains what that diagnosis meant to her.
At that time, I was told that a significant vision loss in my future was highly likely. Of course, one of the first things I thought of was living independently might be challenging.
Pat Bates has lived with AMD for more than 10 years, and the threat of losing her vision has changed her perception on life.
Other than listening to music, I can't think of anything I love that doesn't involve my vision. My lifestyle would change dramatically. Since my MD diagnosis in 2012, I've been driven to see as much as I can. I've always appreciated nature, but now I have a heightened awareness knowing that it may be taken from me someday.
Dr. Terry Swinger, who has helped patients with intermediate AMD, has seen AMD from both sides.
I'm a very active 82-year-old retired optometrist, and nearly everything I do involves my vision. I exercise a lot. I enjoy being outside. I'd say way over 90% of my life would be adversely affected if I didn't have the quality of vision that I have now.
ForeseeHome patients are supported by a dedicated monitoring center. How has their experience been with the center?
My experience with the No-Tel Vision Monitoring Center for over 9 years has been amazing. Great customer service is rare, and great customer service is exactly what I received for those 9 years.
They have a patient portal that has been great. I actually started reading the articles because people asked me about it, and there are great articles on there. There's good research, and it's really been giving me great comfort.
My experience with the No-Tel Vision Center has just been excellent. It's been seamless. It's been over the top good. Annie called me. She was extremely patient and walked me through it until I understood it completely the first time before I got through it.
Can elderly patients use a digital device on a regular basis? Let's ask them.
My experience with testing was very positive. I found the device very easy to learn to use. This tool was going to be the chance that I had of retaining functional vision for as long as possible. So that in itself was very motivating.
It's easy to do. It may take a couple of minutes on each eye, and I test each morning with it. And with the ForeseeHome, I still have dry AMD. I still have 20/20 vision in each eye, and I monitor every day with this.
ForeseeHome works by generating alerts for physicians when a change is detected that may indicate a conversion to wet AMD. However, an alert may not always result in wet AMD diagnosis.
The visit I had with my retina specialist after they called with a positive test, he just did the testing and he said, no, your vision hasn't changed any. And I was pleased that he had me come back in a month because I think that was very helpful. I know people are watching out for me, and so they're doing their part, and certainly Nodal Vision has given me peace of mind.
Studies show that people who do convert to wet AMD in one eye are at higher risk for conversion in their other, or fellow eye. After her first eye converted, Jane decided to continue to monitor her fellow eye with ForeseeHome.
The conversion with the second eye was more shocking to me. I had tested, and a couple hours after I tested, perhaps maybe not even that long, I had a call telling me that I had had an alert. So I got to the office, had another scan. The doctor walked into the office and said, Jane, you converted. I was so grateful for the alert because my next scheduled appointment was many weeks out. One of the things I remember very vividly about that appointment was my doctor said, Jane, this Forsee device has served you very well. And that might be an understatement.